Our need for hospitals didn't end with the pandemic. This session, hospitals need commitments from the Texas legislature to help fill critical open jobs in healthcare, ensure financial stability, and bolster behavioral and public health resources on behalf of our patients. Visit THA.org to learn more about our work to protect Texas hospitals and the patients they serve.
This is where the future begins. It's time to invest in our future. It's time to help our schools improve for the future. And it's time to give our educators what they need to innovate for the future, because the future of Texas is in our public schools.
Open enrollment is here. This is a time for many Texans to decide which health insurance plan is best for you and your family. Blue Cross and Blue Shield of Texas offers multiple health plan options, some with $0 copays in all 254 counties. Our Think Blue team is here to help you enroll. Visit thinkbluetx.com to find a free event near you or to register for one of our virtual seminars. You can also call us Monday through Friday at 866-427-7497. We look forward to serving you.
Our need for hospitals didn't end with the pandemic. This session, hospitals need commitments from the Texas legislature to help fill critical open jobs in healthcare, ensure financial stability, and bolster behavioral and public health resources on behalf of our patients. Visit THA.org to learn more about our work to protect Texas hospitals and the patients they serve.
This is where the future begins. It's time to invest in our future. It's time to help our schools improve for the future. And it's time to give our educators what they need to innovate for the future, because the future of Texas is in our public schools.
Open enrollment is here. This is a time for many Texans to decide which health insurance plan is best for you and your family. Blue Cross and Blue Shield of Texas offers multiple health plan options, some with $0 copays in all 254 counties. Our Think Blue team is here to help you enroll. Visit thinkbluetx.com to find a free event near you or to register for one of our virtual seminars. You can also call us Monday through Friday at 866-427-7497. We look forward to serving you.
Our need for hospitals didn't end with the pandemic. This session, hospitals need commitments from the Texas legislature to help fill critical open jobs in healthcare, ensure financial stability, and bolster behavioral and public health resources on behalf of our patients. Visit THA.
All right, if we can have everyone come take their seats, we're going to get started. All right, we are ready to get started. If everyone can return to their seats, including the panelists. We'll give them 1 minute till just have your mics. That's true. Do you have your mic? Are they on? No, I think not yet. I think Yes. Yeah. All right, great. Thank you guys so much for joining us for this 2:15 panel on healthcare. I am Eleanor Klibanoff, the women's health reporter at the Texas Tribune. Before we get started, we should say this session is sponsored by Methodist Healthcare Ministries of South Texas, Meadows Mental Health Policy Institute, Blue Cross and Blue Shield of Texas, the Texas Hospital Association, Texas 2036, and the Office of Public Insurance Counsel. So thank you to our sponsors, and thank you all for joining us for this extremely important conversation. I'm going to sort of jump right in, introduce my panelists, the panelists. We've got Donna Howard, a Democrat who's been representing Austin in the House of Representatives since 2006. Representative Howard has also worked as a critical care nurse and a health educator and served as a past president of the Texas Nurses Association, District 5. We have Steve Allison, a Republican who has represented North San Antonio since 2019. As an attorney, Representative Allison has represented businesses, doctors, and religious organizations, and served 12 years on the Alamo Heights School Board. And last but not least, Representative Collier, an attorney and small business owner. Collier, a Democrat, has represented the Fort Worth area in the House since 2013, and is currently the chair of the Texas Legislative Black Caucus. Now, she was the chair, immediate past chair, mere moments ago. Yes, it changed while I was printing. Anyway, well, thank you guys so much for joining us. This is obviously such an important topic going into the session. It's hard to think of any topic where more has changed in the last couple of years. And to start sort of big picture about, healthcare access and the state of our healthcare systems in Texas. We are sitting at almost 3 years after, COVID-19 first arrived in Texas. Our healthcare systems were, a little battered and bruised before that even, and now, we are facing significant workforce shortages, extremely high costs for hospitals and healthcare providers. I'm sure you all hear from your constituents about the trouble they have accessing healthcare. And, a recent Texas Hospital Association study found that 1 in 10 Texas hospitals is at risk of closure. With all of that facing this state, what can and should the legislature be focusing on this session to try to sort of get our healthcare systems off of life support? Representative Howard, if you want to get us started.
Sure. I mean, that is a huge question with multifaceted answers that I'm sure we'll all kind of chime in on. But clearly, access has been an issue for a long time. And that has to do with a lot of factors that have been exacerbated by COVID. Certainly, we do not have the workforce that we need, and that's only gotten worse. The nursing shortage, the physician shortage, the provider deserts we have in our state, the closures of hospitals. As you said, we've had the most closures of rural hospitals of any state in the union. That is a real barrier, obviously. But then, of course, we've also had the barriers of not having expanded Medicaid. We have the barriers. Well, quite frankly, I'll have to say that with that particular issue, we've got about, just ballpark it, 5 million Texans that are not covered right now. Expanding Medicaid would cover maybe 1.5, 1.7 million, something like that. So there's still several million that would not be covered even if we expanded Medicaid, and that has a lot to do with navigation of the system to find coverage that they can use, and not understanding that they can actually get something that's affordable. So part of the challenge there is having the navigators we have to have in place to help people access the coverage that they can get. So bottom line though is if you don't have some kind of coverage, you don't have access, regardless of whether there's providers or systems, you've got to have the coverage. So all of these things go hand in hand, and all of them require our attention. We can talk more specifically as we go on here, but really expanding Medicaid at this point in time should be something we should be able to embrace on a bipartisan basis and just do. It is something that will tremendously benefit our state. We're way behind the ball on doing this, and this is the #1 thing we need to be doing this next session.
And we're going to get in the weeds on, the viability of that. But Representative Allison, any thoughts on sort of big picture, other initiatives you'd like to see the legislature take on?
Well, no, I think that access is just critical in all factors. Mental health, I think, is going to be a major issue that is also an access problem. I agree that we need to address Medicaid expansion. However, whatever we call it, but I think it's critical how we do it. I think one of the problems that we have with our access situation is we don't have enough physicians and providers across the spectrum. And I'm afraid that if we don't expand or provide additional Medicaid in a way that will attract more physicians back in the fold, and I think a fundamental part of that is that we have to increase the reimbursement rate.
Yes.
And I think historically, the states that have done that around the country have found that physicians have come back into the fold, so to speak. We have a critical shortage of physicians in Texas. I think it's become a ever worsening situation, largely because of the pandemic, and a lot because of the reimbursement situation. So I think that's something we really need to focus on. And I have trouble, just in my view, but others I've talked to in the healthcare field, if we don't increase the reimbursement rate, we can't make it work.
Agree. That's exactly what I was going to talk about, Steve, is the reimbursement rate, because it's hard to get somebody, a healthcare professional, to participate when they would lose money and their business would end up closing. So we have to have the reimbursement rate and the adequacy of the network, so that way people can have access. So that means the health insurance companies, we need to make sure that they have adequate networks when there is coverage. Another thing is the totality of the circumstances. When we're talking about healthcare, stress plays a big role on the overall physical health of somebody. So if I don't have access to, an employment, the ability to take care of myself, my family with dignity, then that could have a negative impact on my health. So let's, traditionally, yes, I need to go to the doctor, but I need to be in good emotional and mental health, and I need to be strong there. So that means I'm, have a job, my children are, taken care of. So those are things that play a role, that I have access to healthy foods, and fruits and vegetables. These are all things that play into having, having good health care.
Right, that holistic health.
Absolutely.
Yes. Representative Howard, I know one issue you have tried to tackle in the past and have filed a bill again on relating to our nursing shortage is that workplace violence protection for nurses and like that piece of the puzzle. Can you talk a little bit about why that's a priority for you?
Yeah, absolutely. I think traditionally it's kind of been thought by the profession that it's part of the job. And, we're in a hospital setting in particular, there are just by nature, the nature of who's in the hospital. You have people who have dementia, you have people who are on medications that alter how they're approaching things. You have traumatic situations with family members involved who are very upset, all kinds of things that create an environment that can be very difficult. I myself was attacked by a patient in ICU back when I was working there. I know Stephanie Click, another rep from Fort Worth, that she had a gun pulled on her at one point when she was working. This is a common thing that happens in hospital settings, and we know, unfortunately, that it can turn very deadly. But just the day-to-day can be very difficult. And so over the years, we've tried to work with creating policies that would protect nurses and other hospital staff members and set up some policy committees and that sort of thing. But we really just didn't have the enforcement mechanism in place. And we have come to some agreement. The Texas Nurses Association, the Texas Hospital Association, the Texas Medical Association have all signed off on this legislation, which will give more emphasis to making sure that the policy committee is working, has the policies in place, has the training, is going to have interventions available if indeed something does occur. It's just a more robust way of addressing it. But the main thing is that it has all the stakeholders signed off on. So hopefully, we had it last session. It just didn't, the timing ran out and we didn't get it through, but hopefully this time it can be a priority because clearly the workplace setting is also a factor in retention of staff. And COVID made things worse with violence as well. And we've got to do everything we can to help ensure that we have the healthcare personnel we need because clearly we all need that. When we need their services, it's extremely valuable, and this is one of the ways that we can help address that.
Great, thank you. As all three of you mentioned, Texas is now one of just 11 states that has not expanded Medicaid. We have the highest uninsured rate in the nation. The top 5 highest uninsured states all have not expanded Medicaid. Last session, you all, supported this legislation, the Live Well Texas program that was maybe as close as we're going to get to Medicaid expansion. Representative Allison, can you talk about, as a Republican, that bill did have bipartisan support. What appealed to you and some of your party members about that versus, the more traditional Medicaid expansion? And do you think we might see any similar momentum this session?
I hope so. We had very few of us on the Republican side. I signed off on that bill and worked quite hard on it. Again, the fundamental piece in my way of thinking was the increasing the reimbursement rate. I think that had to just be the starting point. Because I've often used the example, and nothing against Iowa or Indiana, but we're not Iowa or Indiana. We have far more people and far fewer physicians and providers. So I think the only solution is to address that problem and increase the reimbursement rate so we can have more providers and more physicians that are necessary to cover the influx of Medicaid recipients. And then beyond that, I think what may become more attractive to the Republican side anyway is if we put in a wellness incentive, if not a wellness requirement. And I know we're working on that now to see if we can't adopt rules or provide a rulemaking authority where there'd be a wellness requirement for the recipients, because I think we all benefit from that. If we have a healthy and well populace, whether it's Medicaid recipients or otherwise, we all do much better with that, and costs come down. And then in addition to that, some sort of workforce or job incentive or requirement, because if we can get people back employed, recognizing that some of the Medicaid recipients just are going to be incapable of holding a job or seeking employment. But those that can, I think, again, we benefit if we get them onto a private plan or employed and healthy. We all benefit. So I think those are the type of approaches we can make. And I'm cautiously optimistic we're going to see some movement this session.
That sounds really good. However, the wellness for the recipient, okay, I can understand that, but if we're going to have a job requirement, then maybe we need to also make sure that they have access to childcare that's affordable. So, I mean, if we're going to put parameters or put measures in place that where you can, I guess, measure the outcome or, you know, the quality of it or the effectiveness of it, we got to think about how it actually works on the ground, because it sounds good on paper, but then all the ripple effects. So I'm required to work, but then I can't get childcare. Then might as well stay on assistance, because that way I'm not breaking any rules. You know, I can just. So I think that we can't get in the way of ourselves. We have to make sure that it actually works and it does what it's intended to do. So the wellness incentives on the individual, I think that we're expecting, if we're putting, I don't want to put too much on the individual, because if I say you have to comply, well, I want to comply, but the pharmacy, you know, the medication there is so expensive, or the doctor's office is far away. So let's, you know, if we're going to talk about having compliance issues, because this is one thing I did learn. I didn't realize how personal medical professionals take compliance. They feel like it's something on them that if you're not complying, and it's not always you. It might be something that I am dealing with in terms of my circumstances. Like I have to drive, you know, 600 miles to get some health care or something like that. I can't come back to the doctor for the follow-up. So are we going to penalize the physician, the hospital facility, and the individual because of their location, because of these circumstances? So we have to be mindful, and that's where you guys come in. And you tell us, you know, hey, look, that sounds good. And of course, I understand the responsibility, the fiscal responsibility behind that. However, when they're in these situations, it may not work that well. So.
Do you have anything else to add on that? Or?
No, that was great.
Okay. You know, last session, we did see similarly some momentum, at least initially, around expanding postpartum Medicaid for a whole year after someone gives birth. Made it through your chamber. The Senate knocked that down to 6 months. That is now sort of stuck in bureaucratic limbo. Representative Collier, what do you think are sort of the odds of us getting that year, and why is that important from your perspective?
Well, it's very important. The maternal mortality rate for Black women is exceedingly high, and I'm disappointed from the report that we just got from HHS, which it's not even the same as the one they gave out last year, but I think they're going to come out with some more information, because they don't distinguish the rates between the race and ethnicities like they've done in the past in this current report that just came out the other day. And the recommendations to address maternal mortality are not, I don't think that they're finished. I think that there's some more information that they're going to share with us. But having access for 12 months is very vital, because we don't have evidence that within those extra 6 months there's fraud. No, we know that there's compliance. There's better compliance when I have that coverage for myself 12 months after the birth of my child. So definitely making sure that those 12 months happen. The system is going to be fine. We already have things in place that would identify fraud. So I think that is very key, and I feel like we are very close, and that we will get that, especially with this $27 billion that we have extra to deal with. But I feel confident that we'll be able to get the 12 months for this next session.
Would you like to add something to that?
Yeah, I mean, the Maternal Mortality and Morbidity Review Committee, this was their number one recommendation. And that's the folks that we have tasked with looking at this issue. And that's what they have been recommending since they've been making the recommendations. So it's also a recommendation at the national level. And in fact, part of ARPA included some incentives to expand to 12 months. And if you expanded to, the typical has been 2 months. That's what has been the minimum requirement by the feds. And we were only at 2 months postpartum, you were off the program. But the federal government wanted to extend it to 12 months because of the medical outcomes, advantages of that. So ARPA said that if you do expand it to 12 months, you don't have to do a waiver. You can just amend your state health plan, which is a lot less bureaucratic, it's more expedited. It would have assured that we could have quickly moved into this. But because we applied for 6 months, and that wasn't the recommendation, and because of some language in the bill, the federal government refused to approve our 6-month waiver application. And so we still are operating under the 2-month, except for the fact that because of the public health emergency, everybody that was on Medicaid when the public health emergency was declared back March 2020, they're still on. So anybody who was on the pregnancy Medicaid program back in March of 2020, instead of getting kicked out at 2 months, they're still on the program right now. They're still getting covered by Medicaid. And to me, that is a unique opportunity for us to look at, has it changed the health outcomes of these moms who stayed on now for a couple of years? Did it make a difference? And we've asked the agency to try to help us determine that, and we're hoping we get something that will show it, because clearly not having to find a different program, a different provider, the gaps that occur, that didn't have to happen this time. So did it make a difference? I would suggest that it probably did. I'm hoping we'll be able to find that out.
Yeah, absolutely. I mean, I've talked with providers who've talked about, women have been able to stay on in between virtually the entire time in between their pregnancies, and like what a difference that makes.
Exactly. One of the most significant public health events of the last century was family planning. And the reason for that is when you space your pregnancies, you have a decrease in maternal and infant mortality. Huge thing for us to have that ability to space pregnancies. And this has been a way they've been able to have that continuous coverage, be able to get contraceptives, be able to have the health care they needed so that hopefully they weren't having the pregnancies too close together, which was going to be more dangerous.
Representative, yeah, please.
And it seems like what we've been missing is, access is just part of the situation, and outcomes is what we're really after. And it seems like the 12 months is a no-brainer. As Donna said, that would have made life much easier if it came back to the state system. 2 sessions ago, we passed a similar bill in the House, and it didn't see much life in the Senate. This last session, we passed the 12-month in the House, and the Senate cut it back to 6 months, and I think we accepted it out of desperation that something was better than nothing. But I've yet to hear really a solid explanation from the Senate as to why 12 months wouldn't work. So I'm very optimistic we're going to go back this session and get it to the 12 months where it needs to be.
Right. And that's certainly a thing that's changed. I mean, when we passed 6, it was easier to say, well, we're ahead of some states. And now a lot of states have passed 12 months, so we're sort of suddenly behind the ball on that, right? We've talked about or alluded to the maternal mortality report. Texas has above average maternal or above the national average maternal mortality numbers, which is saying something in a country that has the worst maternal mortality numbers in the developed world. And we know that maternal mortality disproportionately affects Black women and Black people. Representative Howard, can you talk a little bit about, the status of that report that we do not yet have, and sort of what that delay will mean for legislators? Yeah,
and it does turn out that tomorrow morning the review committee is actually meeting, and we'll be getting some kind of an update from the new dishes commissioner. So remains to be seen. We'll see what happens tomorrow. But at this point in time, we still don't have the actual report, even though it is required in statute that this report was to be distributed September 1, which it's a whole nother issue, but it points out the inadequacies of our system where with a part-time legislature, we have no capability of enforcing things between sessions. If we're not in session, there's just nothing we can do. We send letters, we talk to the media, bring attention to it, but the only person who had the ability to do anything about it is the executive of our state, the governor, who also appoints the commissioners and could actually demand certain things of them. But this draws us to a problem here when we're talking about a statute that says you shall do this and it's not done. The fact is we still don't have it. We did request some additional information about an intervention done with obstetric hemorrhaging, which is one of the leading causes of mortality and also severe morbidity. And we did get that information. So it did give some of the stuff that Nicole was referring to.
This report?
I can't see without my glasses. So.
They did release a report.
Talk about health issues.
Yeah. Look, I put my glasses in my purse. I got it right here.
Anyway, the fact is that was an intervention that was done that is a great thing that's been being put in place. A protocol to have hospitals prepared and ready to intervene with some best practices. And it has made a huge difference with outcomes. It significantly reduced the complications of obstetric hemorrhage across all of our population, except for our Black moms. Theirs actually went up. And so part of the concern we have and why we want to see this is, well, for one thing, what the heck's going on here? Because we don't know how to intervene and put in place those things that are going to address these issues. But also there's concern that we are actually seeing the implicit racism, the biases, whatever it is, that is making sure that the Black moms are not getting the same kind of outcomes that all other moms are getting. And this particular report also for the first time has some kind of a factor that they've built in that looks actually at racial disparity. So we really need to see it to know what we need to do, because the whole point of this is to keep moms alive and to keep them healthy. And we have to have that information to know what policies are going to give us that kind of an outcome.
Representative Collier, were you saying?
Well, I was going to say, they did release a report. And in it, it's only 34 pages. Typically, it's 74 pages. But I had to really do some digging to find it on the HHS website. It's dated December 2022. And it's the same title, State Efforts to Address Maternal, and they added depression, mortality, and morbidity in accordance with the same statute. But it's still different, and a lot of it says, we will update. We will update. So, they did do a report, okay? In your face, literally. We did it, but we're going to update it. So it still needs to be, completed. It needs to be final, so that way we could take action going forward.
What actions would you like to see? I know it's hard to say that without the recommendations from the committee. But
well, that's where exactly. We need to see what they found to make appropriate adjustments within the healthcare system, because that's what they're tasked with. They're tasked with identifying the gaps, showing where we're strong, where we need improvement, and from there, we can make adjustments, and also hearing from the stakeholders, the providers, the actual people that are in place. You look at this report and you say, oh yeah, that's true, this is what we could do to address that, less paperwork, more actual, maybe the pharmacy stuff is too much, the prescriptions, things like that, more telemedicine, I don't know. We just need to see that report to help us make those adjustments and follow those recommendations. And funding, we need money. We need to fund these programs.
Sure. Representative Ellison, I know there's been a lot of attention on maternal mortality in the last couple years. Do you see that as an area of potential bipartisan collaboration? Is there interest in your party in sort of working on these issues?
Oh, absolutely. I think that's inescapable. I think that's in everyone's best interest, and I think there are just several pieces to it. Expanding to 12 months, I think, is a piece of that. Back to the wellness concern, I know it's one of our sponsors today, but in my area in San Antonio, Methodist Healthcare Ministries has done a tremendous job by setting up clinics throughout the greater San Antonio area, but also into South and West Texas, to provide better access, that hopefully it'll provide more patient access and there'd be some ongoing treatment without the onerous burden of having to travel a great distance for care. And I think that's an important piece. And then, of course, funding. We're going to have this ungodly surplus this session, and I think we need to use it in areas that help everyone like this.
Thank you. That's probably a good segue to, my favorite topic to discuss, perhaps not y'all's, which is the current state of the abortion laws in Texas. And, Texas already has, as we said, a very high maternal mortality rate. There are some, researchers who are doing some early projections, and as we've seen in some other countries, that there are often, negative maternal health impacts when abortion becomes more restricted. Representative Howard, can you talk about sort of what you are predicting, to the importance of this maternal mortality information in that landscape of reduced abortion access?
Sure. A couple of things there. One, we do keep track at the state level of complications related to having an abortion. And that report over the past 10 years, there's been one recorded death due to an abortion without any information about what the implications were, so I can't speak to that. But over that same period of time, of course, there's been hundreds of moms that have died due to pregnancy. So we're talking about at a very basic level, not having a choice about something that can actually result in death. We also know, though, that over half of the births currently in our state are paid for by Medicaid. And those people who will not be able to access abortion health care by traveling out of state, taking off work, finding childcare, because the majority of abortions are to those who already have children. But doing all that logistical stuff, you have to have a certain amount of resources to be able to do that. So it's going to be those that have the resources will be able to travel out of state and go to a state where it's legal, unless the legislation comes through that tries to prevent our travel, which is being talked about. But anyway, that means that the people who are going to have these unwanted pregnancies are going to be those of limited means, which also in our state, because of the way the economy is here, disproportionately impacts women of color and rural women. But they will be the ones that will be having more babies. So we can anticipate, and we have asked again also for these numbers from LBB and from the agency, what do you anticipate the increased number of births are going to be to Medicaid in our state? So there's a lot about the funding issue we've really got to be looking at here in terms of supporting these moms and their babies. I say that to my colleagues who label themselves as pro-life, that this is the outcome of that means we're going to have more babies and more moms having babies, and let's show that we can support those moms and babies by funding the very programs that are going to allow them to have healthy births and to be healthy after they have their births, and that those babies will be healthy too. So one of the things that we're recommending, and hopefully we can do some things on appropriations, but we want to double the money for the federally qualified health centers, because that's one area where anybody can access those clinics that, like you're talking about, and get the health care they need. We've got to have more of those in place, and we've got to have them all over the state. We need to look at mobile clinics. We need to look at telehealth and telemedicine. We need to look at everything that we can do to support these moms and babies, because we're going to have a lot more of them. We're not even supporting fully what we have right now. Mm-hmm. So that's really where I'm seeing a lot of what we need to be doing and how we could all be working together on this.
Right. And so just to piggyback on what you were saying, Donna, I'm not sure that Texas is ready for the economic consequences of what we're about to see. And of course, I would like the data too to see about the increased births. But when you're talking about mandating, having a gestational mandate for someone who's been traumatized, that could re-traumatize that individual. So we need to make sure that our behavioral and mental health programs are in place, that they are funded and they're available for individuals. So I'm concerned about that. And we already have a foster care system that has been ruled by a court to be dangerous. So why are we, setting a child to be into that system, for our program, which is not in a good place right now. So we need to do more to address our foster care system, make sure our mental and behavioral health funding is getting into the hands of those that are providing those services. So I think that And then jobs. We need to make sure that we have opportunities in our education system, literally. I mean, it's all, I can go on and on about how this is going to impact just about every industry, in Texas.
Just one addition. I think one area that has not received the attention, publicity, marketing, whatever, is the alternatives to abortion provision that we passed last session. That I think that has $100 million in it, which I believe is inadequate. But the details of that, I think, really need to be explored and enhanced. It includes extensive counseling, job placement, housing, food, clothing. I think the more we can do there, dealing with the situation, the better. And I think all the things we've been discussing so far, whether expanded Medicaid, whether the increasing to 12 months, I think all goes towards that increased attention to our pregnant mothers.
Well, there's a lot to talk about there. First off, I mean, alternatives to abortion. If abortion's illegal, we don't need alternatives to abortion. Mm-hmm. We don't have abortion. These programs that have gotten funding, and I understand how it's been discussed and portrayed, but when we look at trying to get metrics and accountability, it doesn't exist. And the fact is that part of the metrics have been handing out pamphlets. I mean, seriously, you get a mark of, this is how many units of things you've done. Handing out a pamphlet is equal to providing 20 minutes of counseling or whatever it is. It's an unaccountable program that does not have medically accurate information, that has been used as a portal for getting people to who are pregnant to not have an abortion and instead carry the pregnancy. And they do provide some opportunities for some job placement information, parenting information. They do provide some diapers and car seats and those kinds of things. Those things can be provided by a wide variety of social service agencies. These are not medical facilities. They don't provide any health care to these people who desperately need health care. Those dollars could be much more effective in the healthcare system to actually provide healthcare to these people and get them what they need for healthy pregnancies. I have visited one here in Austin. Good people, good-hearted people trying to do good things, but it's not, to me, an effective use of our taxpayer dollars. And if we're going to have any kind of a program like that, we need to look at what already exists in social service delivery programs and help those be more effective. Get these people into the Healthy Texas Women's programs, any program that we already have that exists, get them into these programs, the nurse-family partnership, those kinds of things that actually can make a difference and actually have evidence-based outcomes. And the final thing I'll say is that there has also been evidence of some misappropriation of funds. There is just not enough scrutiny of this program, and for me to in any way come near to having said this is a program we should continue, much less add money to, there's going to have to be a lot shown to me about accountability before I would ever go anywhere near that.
And yes. In fact, I had just learned that they don't have healthcare professionals running these facilities. And I was told it was a sham. This is just a basic sham. But what I do appreciate is all the contraceptives that they provide. The condoms and the birth control pills. Right?
No.
Oh, no, they don't even do that. Mm-mm. Oh, okay. So, again, this is, if you're talking about alternatives and helping people have a family planning, that has to be built in to any type of program.
And why isn't it? Why can't it be? That's what I'm saying. I think that program need to be enhanced. And I agree with you fully. There needs to be more accountability and transparency. But I think that is a viable alternative to explore and better fund, better oversight. I agree with you. I question some of the subcontracting that's been going on. And I think that's one of the fallacies in the program, the way it exists right now. That it's just subject to the whims pretty much of the subcontractors without the necessary oversight. But that's why I think if we funded that better and more efficiently, I think it'd have great benefit.
And Plan B?
Pardon?
Plan B, would that also, I know I'm pushing it too much. Huh?
Representative Allison, I know you have said before the election, you said that you were interested in potentially hearing the legislature consider adding a rape and incest exception to the current abortion ban, which provides which is a near total ban except to save the life of the mother. Is that?
Yeah, I'm certainly open to that being considered. I think it was unfortunate it wasn't. The only bill or proposed amendment came late. It was a Republican, my friend Lyle Larson, and it didn't even get a hearing. So I think it would behoove all of us to explore that better. I noticed, read a blurb this morning that the Lieutenant Governor is even non-committal on whether it should go forward or not, and I know there's interest to do it, and I think that we need a full hearing and discussion, not just the emotion that's going back and forth from both sides on the issue outside of that, and we've never had that on the House side anyway, and I don't believe the Senate's come close to it, but I think that'd be very valuable to explore and see the pros and cons of adding rape and incest exceptions and what the details might be. Yeah, I'd be fully supportive of that.
Add to that, yeah. I think one of the concerns, if we could even get near doing it, as you point out, I don't even know if it's possible, but is to not re-traumatize the survivors. We know that the studies have shown here at the University of Texas that only about 9% of those who are assaulted actually report. And one of the reasons for that is because oftentimes the person who did the assault is a family member or a friend or somebody who lives in your home, and people don't want to report that. And the concern is that there would be a requirement for reporting in order to get the abortion, and that would be forcing a survivor to do something that re-traumatizes them. And so there's a lot around this that has to be looked at very carefully and not have unintended consequences to it, because personally, my opinion is that I think those who have been assaulted should have the right to terminate a pregnancy that's the result of an assault. That being said, I don't think they should have to report it in order to do that. And so I'm not sure how this would come out, but there's a lot we're going to have to think about as we talk through this. And then I guess just going even back to pre-overturning of Roe v. Wade, the concern then was, do you have to be assaulted to be able to seek an abortion? That's the only thing that justifies your being able to seek an abortion if you've been assaulted? There are other reasons that people seek abortions. And there was a concern about limiting. Now that's almost moot at this point. So now we're looking at, again, a lot of it's looking at how do we make it less bad?
Right, I mean, and so Representative Allison, as you mentioned, Lieutenant Governor, Dan Patrick wouldn't even really commit to considering a rape and incest exception. In fact, said basically, I'm not saying no, but, which, is as close to no as I think you can get. But from your sense, is that sort of rape and incest, is that going to be the furthest reaches of the conversation in one direction? And I mean, where do you think the conversation around abortion from your party may go in the other direction in terms of tightening those laws further or making sure they're being more strongly enforced?
Well, I know there have been some bills pre-filed that go in that direction. I don't see them succeeding myself, but I know they've been filed, and I think we need to counter that. So I agree with Donna that there's so many parameters and tentacles to this. I think we need to be very cautious, and that, again, that's why I think it needs a full hearing and discussion in committees.
Great. Well, we're going to talk a little bit about mental health, but once we do that, we are going to open up to questions. I think we've got mics on either side, so if people want to start lining up while we do that. We just have a couple minutes, and this is obviously could be its own panel just to talk about mental health and, the importance of that. But going into this session, there's so much conversation around mental health, so much attention on mental health after Uvalde and other similar circumstances. What do you hope the legislature sort of comes together on and comes out with, at the end of this session on mental health that would feel like a real victory? Representative Collier, do you want to start?
Well, a lot of the groups and facilities that are on the ground, they have wonderful programs already in place. They just need to have help funding them, expanding them and access to them. But actually providing information and education to individuals, we've done a good job in Texas of removing or reducing the stigma associated with mental health treatment. And so we need to keep that going in terms of letting everyone know it's fine, it's okay to not be okay, and it's okay to get help. So I think that that's something that we need to continue to grow, that education piece, but the funding and at every area. I mean, we got to get it into our schools. We have to have, these are things that we could do within the school systems. Our churches, being good partners with our churches, anywhere you can go. I remember one time my daughter, she worked at Target and she was checking somebody out, and at that point that person wanted to share. At that point she's like, I'm not equipped to take this trauma, but literally we need to have people in place, whether you're getting your nails done, your hair done. Maybe there's some things that we could do to help be in that place, be that right person to connect that individual with the right people. We just got to think outside the box.
Right. Representative Allison.
This is an important area to me. I think it's an ever-increasing problem and situation. I've often said I think it's unfortunate we call it mental health because it's so much broader than that. And the connotation that, well, I'm not crazy, I'm not sick. Well, it's so much more than that. Whether just anger, propensity to violence, whatever. And we see it through the pandemic. It's been exacerbated. We saw it through the Uvalde tragedy. We've had the structures in place. We've identified it in the past, but just haven't done enough. We did a lot of work on the Children's Mental Health Consortium that I think was an important piece of legislation. Received a lot of pushback and opposition, but I think we're seeing now how valuable that legislation is, and it needs more. We've set up mental health resources through TEA that's set up through the educational service centers. Unfortunately, it was very slow to get in place. We passed it 2 sessions ago, and it was just this past spring when it was finally implemented and ongoing. I think that has proved to be very valuable, along with the consortium, that it's intended to deal with the students and children, but I think we're finding that if we can get the children involved, the counseling is showing that it may not be the child, it's something else in the family or the parents or some other part of the environment that I think is very beneficial. But I think we need to put far more funding into additional facilities. We saw that with the Uvalde tragedy. There's a total lack of facilities and services provided, and particularly in the rural areas, that I think we need to shore up. We can do a lot more with telemedicine. We've done some major steps in that direction, but it's broadband sensitive, and so many parts of the state that really need that don't have the broadband capabilities. I think we're dealing with that separately, but I think we need to expedite that process. So they're just some of the thoughts. We're seeing that the suicide rate is going through the roof. Children, the pandemic contributed to that tremendously. First responders, we saw that the retired first responders had a high suicide rate. Now we're finding that it's coming down into the ranks, the active duty ranks of first responders, because of what society has done, the economy, the pandemic, everything, that we need to provide much more focus on mental health issues.
Thank you.
Yeah, the broadband, just to give a point to that, the latest number that I heard from the comptroller's office, where the broadband office is housed, is that we have 7 million Texans that still do not have connectivity. 7 million, that is a lot of Texans. And we know from what happened with COVID how much we're dependent upon that now for healthcare, for education, for employment, for all kinds of things. So yes, we need to expedite that. I think one of the things that we could use our surplus dollars for is to expedite that process. But I was really glad to see the Lieutenant Governor mentioned additional psychiatric beds in his press event the other day. Clearly, we need more beds. We also need more different types of facilities, though, as well, for partial hospitalization and community homes, halfway houses, quarter-way houses, all the different ones that the step downs that we need to have there. We just do not have them. And again, it goes back to what we talked about at the beginning, providers. We don't have the providers. So we've got to do everything we can to incentivize people going into the mental health care field. Certainly psychiatry is a huge shortage, but I'm also talking about the other providers as well. And with schools, Oh, yeah, that is such a huge issue right now that you brought up, Steve. You know, the Surgeon General has issued that it's a public health emergency, the adolescent mental health situation, and with the increase in suicides. This is really tragic stuff that we're having to be paying attention to. And, you know, school funding is going to be a big part of what we're going to talk about this next session. We made some headway last time about ensuring that counselors had more time to actually do counseling, but we still don't have that really in place, and we're still way behind with counselors in our public schools. There's so much that needs to be done here, and I guess my bottom line expectation and hope is that rather than just going out there and throwing things at different things to say we did mental health, that we'll actually look at this real strategically and think about what's the best way we can invest in this issue across all our agencies, across all industries, whatever we need to do here. How can we take a holistic approach to this, use this unique opportunity we have right now with everybody focused on this issue? It's bipartisan, we're all focused on this issue, and we have this surplus. What can we do that will really take us further down the path than we would ever have had an opportunity to do otherwise? So it's a real opportunity. I hope we'll take advantage of it.
Great, thank you. We'll now go to questions, as always, you know, questions come with a question mark at the end, and we'll ask you to, be as succinct as possible. Do you want to start over here in the blue?
Hi. I just wanted to talk about, there's another side to abortion that most people miss, as it was not discussed. There's a disregard for expectant mothers who have abnormal pregnancies where their babies are terminal. We're talking about traumatizing mothers, and that is a traumatic experience, especially for babies that are wanted, which those are. They don't have a choice anymore. I'm really I want to know, are you okay? And I believe everybody deserves a choice. If you are raped, if it's incest, no matter what, you have that choice. But is that something that's on the table? Are you okay with removing the choice for someone to humanely end their pregnancy if their baby is terminal?
Let me start real quick, and maybe Steve has something to say about it too, but we're definitely looking at that issue, and we're working with the physicians to come up with clarifying language that takes away that ambiguity that has prevented the physicians from feeling comfortable without the fear of liability and even losing their license and even going to jail if they don't follow what they think the law is being interpreted to say. So indeed, yes, totally agree with you that that's got to be addressed. We've had so many instances that have been reported to us and have had physicians tell us that we are having to wait for women to start dying before we can do things. Now that's the maternal complications, but then there's also the complication of fetal abnormalities. And whether or not with a non-viable fetus, we should require that someone go months with that non-viable fetus knowing what the outcome is going to be is indeed traumatizing. So how can we look at all of these things, and hopefully we'll be able to make some headway, because I'm hoping it's unintended outcomes here that we're talking about, but it is definitely hurting a lot of Texas families.
Representative
I agree fully. I can't believe that was the intent of the bill and act. And I think it extends to the concern over a miscarriage or necessity for a DNC. I don't think that was intended to be an abortion situation that the physician would have any questions, but obviously they do. So I'm confident that needs to be addressed and will be addressed to clarify.
Thank you.
Someone over here?
Yes, thank you so much for being great models of civility in discourse and collaboration on these issues that are facing us. In Austin, the sitting state senator, Kirk Watson, is very concerned about child care for Austin, Texas. He's running for mayor. And I was wondering, do you have any information, or that's a tangential issue to the gestational mandate. I don't know if you have information you can share about child care.
Sure, yeah, the child care shortages.
Well, I was going to say that there's some programs within our Texas Unemployment Commission that fund child care programs to expand access to it. So and actually the pandemic is what really exposed the shortcomings for it. And so we started shoring up that program. But absolutely, we have that RISE program where you try to get child care facilities to participate and take individuals, but the rates of payment, I think you can only be absent 10 days or something like that, and then payment stops. But we all know that life happens, and if it's a child, a cold gets spread throughout everybody, and 10 days is nothing, So we have to shore up that program. But absolutely, I'm open to, suggestions on how we can make access to childcare more affordable and accessible, because not everybody works a traditional 9 to 5. Some people work overnight or late night, so we need to also take that into consideration.
Thank you.
Hi. For context, I graduated from high school in May of 2021, and the law in Texas right now is that students are taught abstinence-only sex education, and with the intersection of healthcare and education policy, I'm wondering if the state will actually put in provisions to talk to students about how sex education actually functions, because as a student who attended a Texas public school, I was quite literally taught just to wait until marriage. And with the new policies we have in this state restricting reproductive health care access, I want to know if Texas students are actually going to be educated on how their reproductive health care systems function.
Well, that has been a challenge in our state. We do actually have programs that can be taught that are abstinence plus, but a lot of the school districts don't have any sex education, the surveys that have been done. And many of them do just teach abstinence only. So it is a challenge when we have, especially with the environment we're in right now, with limiting what schools can and cannot do, and some involvement in what's being classified as parental rights. Certainly sex education falls into that. But right now, we already have review committees in schools. Parents have opportunities to have their child participate or not participate. The idea is to try to have, age-appropriate information provided that could be used for healthy social behavior for young people. And there are curricula that we have. Healthy Futures in your neck of the woods in San Antonio. Healthy Futures has been really big on developing curricula that is evidence-based, age-appropriate, and has positive outcomes. So yes, we need to be doing more there and ensuring that you have the education that you need to be healthy, to be able to make good choices for yourself, and to be safe. So I hope we can do more. It's going to be difficult, I think, in this upcoming legislative session to do more.
A piece of this, adjacent, is you are yet again trying to get the state to add contraceptive coverage to the Children's Health Insurance Program.
Yes, we are one of only 2 states in the country that does not reimburse for contraceptives for our youth who are in the CHIP program. The other state's Nevada. So this means that all of the red states, the conservative states, have seen the value of this. We have one of the highest teen pregnancy rates in the nation. We have the highest repeat teen pregnancy rate in the nation. It's fiscally responsible to reimburse, because that means we get a 90-10 match from the federal government. What we're having to do right now is to send these young people to a family planning clinic that is paid for 100% by the state, if they even have one in their community, if they can even find that. So what we're doing is we're taking away the opportunities for these young people who are trying to find a responsible way to not get pregnant, and not reimbursing for it is just makes no sense when this is something that we could do to help address this issue. We've gotten it through the House before on a bipartisan basis. Again, it's the Senate that we've had a problem with, but I'm hoping we are getting some positive comments now that hopefully we're going to be able to get it through this time. I'm trying again.
Do we have someone over here?
Yes, thank you. What was the justification for the elimination of $211 million designated for mental health services, and how will you structure legislation going forward that these kinds of cuts will never occur again?
You're on approach.
Okay, I'm on approach. I'm not sure what you're referring to, but it may be you're talking about the money that was shifted around for,
The governor.
yeah, yes, that the governor did with an executive order for funding
Yes,
other.
ma'am.
Yes, okay. What I can assure you of is that it's a net zero impact here. That part, the money is there. It was a how to do this. Taking money from one pot and putting it in another pot and switching things around is the best way I can explain it. It was a complicated process that had to do with federal COVID funds and FEMA reimbursement funds and substituting this for that so that the money could literally have, he could legally do it. But the dollars were taken, in a sense, from what you're talking about, but those dollars were replaced with other dollars, if that makes sense. So, but a whole other issue to talk about one day is executive authority that the governor has, because we are a part-time legislature and he gets to do whatever he wants to in the interim. And because of public health emergencies and public health orders and disaster declarations, he has the power, even though we're the appropriators, he has the power to move money around without our involvement. And
Line item. He can do line item for the budget.
Oh, yeah, you can do that, yeah.
But if
that's
it's a
what you're
bill,
talking about.
he vetoes the whole thing, but the budget, he can take from pots.
He was actually able to move money, though, from one strategy to another, from one agency to another, do what he wanted to with that because of his executive authority during a disaster.
Great, thank you. We're going to do the last question, and then, sir, maybe you could ask if we have, real quick, last question.
I know that Governor Abbott opposes expanding Medicaid. I'm curious if the legislature has a plan to circumvent him if you guys decide to expand it.
Go, Steve.
Veto
proof?
you mean you're afraid he'd veto it if we passed legislation?
Well, I know that you can also bring the vote to the people. We could decide, and like 70% of Texans are for expanding it. So.
Well, and I think I may be mistaken, but I think a bill's been filed to do just that.
Okay.
Yeah. That's why I'm cautiously optimistic that if we can move towards, like I said, the increase in the reimbursement rate, the wellness incentive, however we characterize that, and whatever details we put in that, and a workforce position, I think we move more to the, I'll admit in my party, to accept that, and I think that would include the governor. I think we're to the point here, there's a lot of money involved that I think that if we do the increased reimbursement rate, it will pay for itself. Plus, the Biden administration, if it's still on the table, at the time there were 12 states that had not expanded Medicaid. Now it's 11, but he had offered an incentive that to Texas would have meant an additional $5 billion over the following 2 years that I think further sweetens the situation. When it's on a 90-10 split, I follow the concerns that if it's just straight expansion of Medicaid, the 90-10 could even backfire. And that's why I think the increased reimbursement rate and these other incentives would work. And I'm hopeful that the governor would see it that way as well.
All right, we're going to do one last question, sir, and then wrap it up.
Thank you very much. I run a healthcare nonprofit. For the vast majority of people under age 65, health insurance is tied to employment. We're worried about reimbursement rates because we have to use that in order to cover the cost of care for people who are uninsured and growing in numbers of people who are uninsured. And our premiums as an employer are skyrocketing, which I imagine is happening for every other employer. What can the legislature do to allow small employers and nonprofits to band together to purchase commercial insurance and reduce the number of people who are without coverage?
Wow, that's great. And I know there have been some discussion about that. Dr. Oliverson has tried to do some things with that. But one of the things that I've been involved with, and I would like to see it expanded if we could, is the TRICARE model, where the state puts in a third, the employer puts in a third, and the employee puts in a third, basically, and tries to, and this is a way to help small businesses, hopefully, be able to afford the coverage that's necessary for their employees. So I don't know what the answer is, but you bring up a great point, and hopefully we can do some work to address that.
We moved in that direction last session by adding the Farm Bureau and Texas Mutual as additional lines to directed really at small business to start in the movement towards addressing your exact issue. But and I agree. I think Tom Alverson is working on more in that direction. But I think it's certainly an acute need we need to continue to address.
Great, thank you. Thank you guys all so much. Let's give a round of applause to our panelists. And we are going to resume at 3:30. There's still food outside, so make your way out there if you'd like to.
This is where the future begins. It's time to invest in our future. It's time to help our schools improve for the future. And it's time to give our educators what they need to innovate for the future, because the future of Texas is in our public schools.
Open enrollment is here. This is a time for many Texans to decide which health insurance plan is best for you and your family. Blue Cross and Blue Shield of Texas offers multiple health plan options, some with $0 copays in all 254 counties. Our Think Blue team is here to help you enroll. Visit thinkbluetx.com to find a free event near you or to register for one of our virtual seminars. You can also call us Monday through Friday at 866-427-7497. We look forward to serving you.
Our need for hospitals didn't end with the pandemic. This session, hospitals need commitments from the Texas legislature to help fill critical open jobs in healthcare, ensure financial stability, and bolster behavioral and public health resources on behalf of our patients. Visit THA.org to learn more about our work to protect Texas hospitals and the patients they serve.
This is where the future begins. It's time to invest in our future. It's time to help our schools improve for the future. And it's time to give our educators what they need to innovate for the future, because the future of Texas is in our public schools.
Open enrollment is here. This is a time for many Texans to decide which health insurance plan is best for you and your family. Blue Cross and Blue Shield of Texas offers multiple health plan options, some with $0 copays in all 254 counties. Our Think Blue team is here to help you enroll. Visit thinkbluetx.com to find a free event near you or to register for one of our virtual seminars. You can also call us Monday through Friday at 866-427-7497. We look forward to serving you.
Our need for hospitals didn't end with the pandemic. This session, hospitals need commitments from the Texas legislature to help fill critical open jobs in healthcare, ensure financial stability, and bolster behavioral and public health resources on behalf of our patients. Visit THA.org to learn more about our work to protect Texas hospitals and the patients they serve.
This is where the future begins. It's time to invest in our future. It's time to help our schools improve for the future. And it's time to give our educators what they need to innovate for the future, because the future of Texas is in our public schools.
Open enrollment is here. This is a time for many Texans to decide which health insurance plan is best for you and your family. Blue Cross and Blue Shield of Texas offers multiple health plan options, some with $0 copays in all 254 counties. Our Think Blue team is here to help you enroll. Visit thinkbluetx.com to find a free event near you or to register for one of our virtual seminars. You can also call us Monday through Friday at 866-427-7497. We look forward to serving you.
Our need for hospitals didn't end with the pandemic. This session, hospitals need commitments from the Texas legislature to help fill critical open jobs in healthcare, ensure financial stability, and bolster behavioral and public health resources on behalf of our patients. Visit THA.org to learn more about our work to protect Texas hospitals and the patients they serve.
This is where the future begins. It's time to invest in our future. It's time to help our schools improve for the future. And it's time to give our educators what they need to innovate for the future, because the future of Texas is in our public schools.
Open enrollment is here. This is a time for many Texans to decide which health insurance plan is best for you and your family. Blue Cross and Blue Shield of Texas offers multiple health plan options, some with $0 copays in all 254 counties. Our Think Blue team is here to help you enroll. Visit thinkbluetx.com to find a free event near you or to register for one of our virtual seminars. You can also call us Monday through Friday at 866-427-7497. We look forward to serving you.
Our need for hospitals didn't end with the pandemic. This session, hospitals need commitments from the Texas legislature to help fill critical open jobs in healthcare, ensure financial stability, and bolster behavioral and public health resources on behalf of our patients. Visit THA.org to learn more about our work to protect Texas hospitals and the patients they serve.
That or bring Donna.
All right, everybody, we're about to get started here. Feel free to take your seats.
Okay.
Oh. Did you travel today?
What's that?
Did you travel today?
Yeah.
All right, everybody, thanks for tuning in and attending. This is our final session of the day, which we're talking about property taxes these next few months in the legislative session. Real quick, I wanted to say this session is supported by Texas 2036 and the Texas Cattle Feeders Association. Joining us today, we have State Senator Paul Bettencourt, a Republican representing Houston. Before he joined the legislature in 2015, he had served as Harris County Tax Assessor Collector and is the chair of the Senate Local Government Committee. And also with us is State Senator Sarah Eckhart, Democrat representing Austin. Before she was elected to the Senate in 2020, she was Travis County Judge for 5 years and is also on the Local Government Committee. Thanks for joining us.
Thanks for having us.
Happy to be here, Josh.
I'm hoping you guys are going to have a little bit, there's going to be some sparks here, so.
What, are you like taking fight promotion, from Evan Smith 101? What's this?
And you might actually be disappointed because laying politics aside, Paul and I agree on a lot.
Shocking.
So that's what I like to hear.
That's right, shocking, because it's the Local Government Committee. So, Josh, we can expand from property taxes to all things local government. Okay, if it helps
I love
you.
that.
All right.
So obviously, Texas homeowners, renters, and business owners, they pay some of the highest property taxes in the country. That's a product of how much we rely on property taxes to fund everything from police to sidewalks to, of course, public schools. State lawmakers have tried to tame the growth of property taxes in recent years, and then have had some success at it. But obviously, property taxes remain high. So, I wanted to just open up real quick with, what is sort of the groundwork, what is left to do this session, and what are y'all looking for?
Well, let's break some news from the Local Government Committee of the Senate. Sarah, what do you think? The average homestead tax bill in Travis County is actually down this year for the first time. All right? Yeah, no, give everybody a hand for that one. All right? Now, if you don't believe me, go look at your bill, okay, that you get and flip it over on the back side, and you can see what's been happening over time, and you can compare it year to year. But basically, you're right, Josh, in Austin, because of the high property values, Representative Howard knows that this is about $9,343 average tax bill for an average homestead in Travis County. And I'm using the city, and the various other departments, Austin ISD, et cetera, as part of this calculation. Now, it would have been a little bit higher than last year, but we also passed a bill that Sarah voted for, which is Senate Bill 8, which allowed people to get credit for their homestead exemption when they first buy a home. Then this was a real problem, because when people were buying homes, especially in the gentrifying areas, they were generally buying for people that had over 65 exemptions. And I'll let Sarah expound on that because they're very low, okay? And so when a new person came in, Josh, your age, you buy a home, okay? And then you get a bill at the end of the year, and it's a shock. I mean, it's thousands of dollars, some cases $10,000 more. We stopped that with SB 8. But the really good news is that House Bill 3, which everyone here voted for, Senate Bill 2, Proposition 2 that the voters passed here at about 86%, which increased the homestead exemption, all that rolled into, for the first time, even with a 51% increase in appraised value, homestead tax bills are actually slightly down. It's an astonishing thing that's happened. On average, it's a great thing, and it's something that I've been working for years, along with Lieutenant Governor Dan Patrick and everybody else that's voted for all these bills.
Do you have anything to add on that?
Definitely. So first of all, I'd like to set some context here, as I think this room, looking around this room, y'all already know this, that since the state of Texas has no income tax, we are heavily reliant on sales tax, oil and gas taxes, and property taxes. And even with the, well, I should say even without the 2019 changes in property taxes, the percentage of property tax bill compared to income for the average Texan is below 5%. So I just wanted to put that in context with regard to income tax versus property tax. And also what Paul said is absolutely true. We are seeing a moment where the average property tax for the average property owner in the city of Austin and Travis County is down this year. The reason why it's down is because of the incredible growth. Even before the property tax changes at the legislative level, Travis County, and I can attest to this because I was with Travis County for 20 years, marked to market an effective that was less than 4%, a tax rate that was less than 4% above effective. We did not want to go above 3% if we could help it. And when there was a growth year, we were below 3%. So we were below the capped 3.5% that was created in statute. I know that that's super wonky, but this is a pretty wonky crowd. So in 2015, even without this legislation, Travis County brought a tax rate in that was less than 3% above effective and resulted in a smaller average tax bill for the average Travis County homeowner. Local entities don't want to take money out of your pocket, but we pay, the state gives us only one mechanism for most of these local governmental entities, and that is property tax. So if we're going to have sustainable long-term property tax relief, the state of Texas needs to buy it down with a different sustainable funding source. Because our population is growing, our needs are growing, and the cost of addressing those needs in infrastructure, education, healthcare, courts facilities, all of that that need is growing and the cost to provide it is increasing. And we need to be realistic about that.
And Josh, if I could add, I just want to make it as the Aggie in the audience here, okay? I just want to explain it to everybody knows what we're doing is as values go up, okay, we're pushing tax rates down because there's a tremendous amount of appraisal growth out there. Now, when Sarah was there, and back in the county, because that's when I kind of first knew about her, because they were actually helping out their homeowners, especially homesteads, by trying to keep that trimmed out to where their homesteads weren't paying more on a year-to-year basis. But not everybody was doing that. Now, for this year's example, to get to this point, the city cut their tax rate by 9 pennies, the county by 4, and the ISD is in between. So what happens is that while you've got tax values going up, you've got this push down of tax rates, which is where the relief is coming from. And to your point about buying it down, the school buy down is the important part because that's going to be over $5 billion now in a biennium, and that's what's allowing the bottom floor tax rates, where it's called maintenance and operation, to come down every year as this value growth goes up. And the good news is it means people aren't getting blown out of their homes, okay, well, especially their homesteads. And that's because that's the critical point of where we saw this problem. So the good news is, yes, it's really happening. On average, you've got a nice Christmas gift. It's not a lump of coal. Same thing's happening in Bexar County and in Harris and Houston. It's actually, there's like a $200 cut, but there was a big fight at county government and the one faction effectively, 2 commissioners forced a no new revenue rate, and that saved some money there too. And Sarah, you don't even know this, but of all the big urban areas, there is one county that's the most Republican that has the highest percentage increase. Guess who that is?
Which one?
Donna? Bingo. Bing, 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 bing. Representative Howard wins, okay? Right, so yes, Tarrant County has the highest rate of increase of 4.4% on homesteads. Everybody else is either negative or much lower, but they didn't want to cut the tax rate. See, that's the big difference, okay? All right, and look, this is all about setting priorities, but and that's what government needs to do with our money. And importantly, but this doesn't happen very often. And we've now, when I first got into office, and even before Sarah joined the committee, because she was in county government, I did 10 years of county government back in the aughts, which makes me really old. We were already number 3 in the highest tax rate in the country. We were chasing Illinois and New Jersey. And I don't care what political model you're with, whether Republican or Democrat, those aren't the 2 most efficient states to be chasing. And we have fallen down to 6th or 7th. And after this year's results, we'll actually fall down to the 10th highest tax rate in the country. That's my prediction. But great news for everybody that's been holding on to their homesteads.
But I want to put that in context, though. It's true. We have among the highest property tax burden in the United States. But if you go to the Tax Institute, which is a federal for-profit think tank that is nonpartisan, and you look at combined state and local property tax burden per capita, we're actually, I believe, 40-something in the combined state and local tax burden. And the reason for that
you don't have an income tax.
We don't have an income tax, and the state pays for less and less every year. So when you consider for public education, for instance, the state pays about 44 cents to every 56 cents that your local school district pays. With regard to public health, you all probably well know, we are the least insured in the United States. We don't accept the Medicaid expansion, and the increment between what it actually costs to provide indigent health care and what is paid by the state is made up by hospital districts. In indigent defense and in court systems, which are the responsibility of the state, y'all, local governments, mostly counties, as the arm of the state, the agent of the state, pays roughly 80 cents to every 20 cents the state puts in for criminal and civil courts indigent defense. So as you can see, local governments pick up more and more of the cost of state services. So I would suggest that rather than blaming the horse, we blame the rider and have the rider, the state, invest in our prosperity long term. That would be the biggest property tax relief, is if the state would structurally fund statewide needs.
So there you've got difference number one for the day, because I don't want to ever get near a statewide property tax system. Would be grossly complicated and difficult to do because we have roughly 4,300 taxing jurisdictions in the state. But the good news is that we've taken some pretty decent steps to solve a problem that's been a really big one for a while, at least give everybody a breathing spell. And we'll see with all this money that we have, and we'll talk about that later, I'm sure that's on your wish list to talk about as well. So go ahead, fire away, next question.
Yeah, I don't think I've asked a question in maybe 15 minutes.
Well then, welcome to a Senate hearing on local government committee.
No, this is what I expected.
We barely let Donna speak, and she visits regularly.
No, but if indulge me for a moment. If the Texas legislature, and this would be a controversial notion, I'm sure, is the Avengers in this scenario, then I am thinking of property taxes as Thanos saying all that for a drop of blood. When you're talking about sort of 175 about on the average tax bill, that's off of a tax bill of thousands. So like, does that continue decreasing over the long term, or what else does the legislature need to do about that?
Well, okay, now, and Sarah mentioned this first off, and I love your Avengers analogy because he's actually talking to Iron Man at the time, okay? So I remember the movie line, very well. Now, so what we set up is an automatic reduction on school taxes. So this is going to continue to be compressed. The minimum M&O rate was about 80 cents, 0.46. The next year, this will fall dramatically into the 70s. So we're trying to set up an automatic system that allows for more buy down and more expenditure of state funds to do this. And look, even like the Proposition 2 that everyone here voted 86% to raise the homestead exemption, the state paid for that. And this is a way to reverse what I didn't like was long-term Robin Hood policy anyway, because that was something that I spoke out against when I was a tax assessor. So at any time we can, at least from my perspective, I'm going to be putting state money in to get property tax relief on schools. Sarah?
So let me throw out maybe a frame that perhaps Paul and I can keep coming back to. I've represented some portion or all of Travis County for the last 20 years. So let's take a 4-person household in Pflugerville that is making about $80,000 a year. If we can give them property tax relief this year that gets them, a couple of $100, that is super sweet. But if we can take this one-time surplus and invest in broadband, in transportation, in healthcare, in education, that family of 4 gets a much bigger dividend than a couple of $100 on their property taxes. That family of 4 will then have broadband so that they can work from home, perhaps a second job if they need to. They will have possibly transportation infrastructure, even transit, so perhaps they could get rid of one of their cars. That's a $10,000 increase to that household's income. They'll have good education and not have to send their child to private school. They will have good health care, and even if one of them loses their job and they fall below a certain income threshold, they may qualify for a short period of time for subsidized health care. If we don't make those investments in healthcare, education, transportation, broadband, that family of 4 has less opportunity, but they did get a $200 bump from their property tax relief.
Well, and part of this is that what and this is why I really like the local government committee. You can actually, we have these discussions, okay, but to go back to your Avengers, let me do Captain America here, okay, on this one. Where there was actually a fight in Pflugerville 2 years ago. One of the problems we have with all the property tax relief legislation is we put it together and never thought that somebody would trigger a 254 countywide emergency. So the lowerings that we did of the rollback rates and all that were suspended. So we have to actually go through a period of time, a whole session, to pull them back together so we can get this tax relief system going. Now, Pflugerville's an interesting case because, let's see, Chair Dustin Burrows and I at the time actually were online with Pflugerville City Council to set, when they were setting their tax rates, and they were started off very high. And so we were saying, do better, encouraging them then. And it really came down to an interesting problem. They actually own a gun range in the city, okay, she knows, and they were gonna spend a whole bunch of money on the gun range, or they were gonna go to the lower tax rate. And I'm kind of going, guys, no offense, even for a Second Amendment person, the theory is that, that government shouldn't be really in that business heavily, and so they actually went to the lower number. But that's an example of setting priorities. See, the problem is, and look, we had a bill that came out of the local government. It was actually Senator Hinojosa and I sponsored. We had a school district down in the valley, La Jolla, that bought a water park and they bought a golf course, okay? And they were losing money on both, okay? So we passed a bill that said, you shouldn't be in the entertainment business. It's a school district, okay? So there's a lot of granularity here to talk about. So what I'm hoping this does, and because here's the big point, Josh, that I missed earlier, everything can be appealed to the public. If she was back as county judge and she wanted to go buy a new jail, or literally, she could take now under the law and go to the voters, like they did 2 years ago on the transportation issue, and say, hey, will you approve it? Lubbock County, shockingly, approved a sheriff's recommendation, okay? And that's the key part of this reform, is top-down guidelines, get priorities set, but if you need it, go to the public and ask for more. And that's a big part of the first ever change in the tax laws in 38 years that we passed in 2019. It's voter participation.
Right. So I want to get into a little bit of the priorities this session, but I want to start big here. Obviously, during the campaign, Governor Abbott, during his reelection campaign, said, we want to use half of this $27 billion surplus on property tax cuts, property tax relief of some kind. Lieutenant Governor Dan Patrick came out last week and said that the state couldn't do that without busting the constitutional spending limit. He proposed things like raising the homestead exemption, raising not raising the homestead. Well, yeah, that is raising the homestead exemption.
That's the right deal. Raising the exemption means a cut.
Right. And there's a couple other things that he mentioned, but I wanted to get a sense from you, Senator. Kind of are the governor and lieutenant governor at odds here? Are they just on different paths? Like how do you sort of characterize where these two are right now?
Well, I think I told Patrick Civitek that it was really a distinction without a difference because it's a slightly different path. But look, just to do the compression that's already in the system is $5.3 billion. The two proposals Lieutenant Governor was talking about, which was raising the homestead exemption and also raising a business exemption, could be equal to that again. So you're already in double-digit billions before you even get to the point of what does the constitutional cap do to you? Now, why we say constitutional is just important because this is a wonky audience. And Sarah's declared it so I'll tell you it. This constitutional cap has only been triggered 3 times out of the last 60 years. That's how much money has come in. And when you do trigger it, you can't say, like in some of our other spending caps, property tax relief is free. It doesn't count against the cap. So you have to look at all of that. And the one thing I'm not going to do is get out in front of the finance committee, new finance committee chair in the Senate or her counterpart, because that's the real discussion that has to happen at this point in time. You can effectively manage property tax relief with business and personal exemptions or compression of tax rates. but it all depends on what type of money is available.
It's just a game of chicken. Whoever blinks first looks weak on giving relief to the property taxpayer. That's what that whole mishigas is about. But I want to go actually to some of our other statewide leaders who are really speaking in an adult fashion about how we can use this unprecedented surplus. Glenn Hager came out very early and said with this more than $27 billion surplus, we should be investing in the infrastructure needs of the state of Texas, and he suggested that we look at water, wastewater. Dade Phelan came out and said very recently, we need to be looking at the ongoing needs of the state of Texas, what the demand is and what the increased costs are, and he suggested that we be looking at transportation infrastructure, at least at the increased cost drivers within transportation infrastructure, and lay aside money. And then I'll also quote Tatara, which I think Paul and I both have a lot of respect for, and Tatara in their 2022 Relief from Rising Values research report said it's going to take many years for Texas to become more tax competitive with other states absent additional infusions of state funds to bring our local taxes more in line. Right. So I think that Dale Kramer from Tatara has made 3 really good suggestions. It's in property tax relief in school financing where the state can have the biggest impact. I totally agree, Paul and I agree, that property tax relief is needed. There are 3 good mechanisms for that. 1, increase the base rate and index it so the state's contribution to public education doesn't erode every year. 2, increase the homestead exemption under school property taxes. It's currently pretty low at $40,000, and perhaps we should look at it being a higher flat dollar figure and maybe even a different flat dollar figure in urban versus rural areas.
Okay, how about 65,000 or 60?
You know, while I was Travis County judge, I think we increased the over 65 homestead or over 65 exemption for county taxes to 85,000.
Wow, you were obviously ahead with a smaller budget.
Well, we had a growth rate. We
right,
had a tremendous growth rate,
and
so we could afford to do that. And then the third thing that was suggested was and this was Kramer's suggestion, was a lowering of the percentage increase that could occur annually off of your appraisal. I'm a little concerned about that for this reason. Your appraisal is just the calculation of the market value of your property. And an accurate valuation gets you a fairer tax distribution. And so if we're going to slow down the percentage increase, it needs to be for all properties. If we just do it for one type of property and not another, if you slow down the appraisal on commercial properties, that just means residential properties will pay more. If you slow it down on residential, it means the commercial properties will pay more.
Well, but the good news is that at least for the last session that I was at in town, apparently the actual cost looked like it's actually per home valuation is actually coming down a little bit again. And the market does self-correct. So part of it is that people see, government as the catch-all here, but really government's taking a snapshot of January 1st on 1 year, and a whole bunch of stuff happens in the other 364 days before it takes another snapshot. So as high as those moonshot appraisals were in the spring here, they've apparently backed off a little bit. So a lot of this has self-correcting, features just because that's the way the system works over time. But look, there's going to be more money. It's going to be X number of billions applied to property tax relief. I just can't tell you what the number is at this time.
I was going to ask you what that X was.
Well, and also can I chime in on the whole idea of busting the cap? The lieutenant governor said very clearly that he didn't want to bust the cap, but that he would look to the possibility of referenda on specific issues beyond the cap, because that's the voter-approved way to get there. Right. And I would suggest that referenda for investments in transportation, investments in education, investments in state hospitals, those are referenda that are likely to pass.
Well, I can tell you one that I think would pass there for sure. would be after Winter Storm Uri. I think that we need to look at one of the problems of the economics of ERCOT and the power grids type of here is that, and again, I'm not trying to make a political statement, it's just fact, because of the federal subsidies for renewables, it's a different game for them to then look at doing gas plant production as an offset. So one of the things that I was thinking about doing and maybe letting the voters decide is we could set up like a SWIFT fund and say, we've got this available amount of money. Would you like to build, would it help you get financing for gas generation? Now, I happen to know, I ran into Energy today. They've just brought on 2 gas plants into their area, which is mostly East Texas. And no matter what you need in a growing state, you've got to have more base energy load. Now, we may disagree on how to get there, but you've got to have a base load that's higher every year, because what we saw in Winter Storm Uri is that you're going to run into basically effects, and what happened in the spring too, where either a storm shuts down your electrical wind turbine grid, or obviously at night, especially during the winter, you don't do a tremendous amount of solar generation. So we have to look at balancing that, and I think the public would vote for something like that because they don't want to go through a freeze.
I agree.
All right, see, news. We broke news on property taxes and on the...
With one caveat.
Oh, she's got an amendment.
I've got an amendment.
Yeah, that's right.
That we be agnostic on energy source.
And you mean I've got to go to Catholic purgatory? What am I? That's right.
So am I just hearing, in order to get around the spending cap, if the ledge is not going to bust the spending cap, we're just talking about going to constitutional amendments on property taxes. Like what form does that take?
To try to summarize this in a little, basically, look, you can have what is a constitutional amendment. You put it before the voters, and you want to designate, $3 billion to set up a SWIFT fund to help build, 5 megawatts of power plants. Great, whatever. Then that goes to the public, okay, for a vote. That's actually the one piece of legislation the governor doesn't veto because it's got to be passed by 2/3 or can't veto, assuming he wouldn't, obviously, in my opinion, I can't speak for him, but be unlikely that would happen. But you can actually pass both houses, passes that out. Like for the property tax relief for both under 65 and over 65, those went to the public, and the public will vote for it or they won't. And so I think there's going to be a lot of those type of propositions put on the table.
So when we're talking about property tax relief, like the big things that we're talking about, personal property tax, boosting that exemption, boosting the homestead exemption, like where is the focus going to be? Is it going to be primarily for homeowners, or are we going to see something that's maybe broader that includes commercial and might include, something that would help renters, for example?
Well, yeah, and that's why I've always been a big fan of tax rate compression. Because when those pennies come off your tax bill, it doesn't care whether you own, you rent. Because most people don't realize that if you're a renter in an apartment complex, it's not that you're getting a free lunch, you're actually being eaten for lunch, okay? Because that's what type of pressure is on when you have everybody in the world buying apartment complexes in Texas. And I mean, it's everybody in the world driving up values. So you'll see a compression, but the real point is you want to have a balanced plan, because basically tax rolls in the major urban areas are half where you sleep and half where you work. Like homes and apartments make up roughly half of the roll, and then all the other business concerns make up that. So you can increase business exemptions, and that's what's been put on the table by Lieutenant Governor. And again, that's a balanced package then for both both homesteads and business owners, because I think it wasn't in our committee. What committee where County Line Barbecue came in and testified that in town they can't hire anybody for less than $25 to $35 an hour anymore?
Yeah.
I mean, this is a well-known restaurant here that is under so much pressure. Forget minimum wage, it's not even on the table. They can't even get people to stay very long at $25 to $30 an hour. Now, when you hear that, well, because we do need to talk about affordable housing, okay, too, as well. These are important things that you've got to take into consideration on tax policy. But a balanced plan is always better than an unbalanced plan.
So for affordable housing, when you're talking about property tax policy, really the only mechanism that directly improves affordability for those least able to pay is a flat dollar homestead exemption. Percentage homestead exemption benefits wealthier people more and less wealthy people less. We can go into the math of that, but a flat dollar homestead exemption is better for low-income people. And I have a bill for a flat dollar homestead exemption. I'd love it if Paul would let me lay it out in committee.
You got a letter?
What's that?
Are you going to letter?
I'll think about it.
So flat dollar homestead exemptions are really the only mechanism to get to affordability for those least able to pay. With regard to affordable housing, broad stroke, the state puts in almost zero into affordable housing. So to give you a statistic to like lay it out there, this is not out of my little brain. In fiscal year 2021, TDHCA expended $3,162,062,000 total funds in tax credit assistance. Tax credit assistance is a federal program. Of the entire budget for TDHCA, only 0.26% of that $3 billion was from the state of Texas. 0.26% towards affordable housing in the state of Texas. All the rest of it is federal or local investment. The way you get to affordability is by increasing housing stock. The state does not put any general fund into increasing housing stock. And if we went to a flat dollar homestead exemption for some of our other local governmental entities, we would be able to get to deeper affordability for low-income folks.
Well, you guys beat me to it because I did want to talk about housing affordability. Because, I mean, obviously what we're talking about partly with property taxes is an affordability question. So I want to get some sense of, is the legislature kind of, I don't know if stuck is the right word for it, but I mean, the primary language that the legislature talks about affordability in is property tax reform, appraisal reform. And, I wonder if there's any sense or any feeling that the legislature would want to play a greater role in sort of the affordability crisis, or what mechanisms you see for sort of ameliorating that.
Josh, not only is there, we've actually had an interim charge from Lieutenant Governor Patrick to study, and we had a hearing.
I noticed.
Okay, right. Well, I did too, because there was an overwhelming number of people of Austin coming in complaining about Austin city government, okay? Now, let me explain why. Austin city government says that you have to have a minimum lot size, and I'm going from memory, of over 5,000 square feet to be able to do anything with affordable housing. Now, in my own hometown of Houston, it's 1,400 feet. Wow. You could build 4 little homes on one piece versus what happens here in Austin. And it just wasn't me. I mean, I was very surprised Habitat for Humanities came in and was complaining really about that, and also the fact the permitting process is like watching molasses pour. It takes forever to get a permit in this town. So I think a couple things that we're going to look at is we need to take a look at some top-down guidelines, because I don't want people forced into a solution that's a high-cost one because government says it has to be. See, that's what's wrong with this 5,000 plus foot cap down here. It's like, oh, we don't want to have any small homes. Well, no offense. I grew up in a small home. And now, but I've got suburban counties that are like saying, well, the minimum house size should be 3,000 square feet. These are anti-market, anti-growth, anti-reality of what it takes to get started in a home, okay? So I think we're going to look at those. Now, the other thing is I think we need third-party review, because quite frankly, if these cities and counties can't get a permit out in 2 years or whatever it's taken, then we should have an override position. Because, look, this is now, and let me just say something, like in the city, last time I checked, I don't know, there's a mayor's race going on, so I assume this it's pretty much obvious. I think the town's 75% Democrat and 25% Republican. So, right. Yeah, so this is not a partisan comment. It's a reality that no matter what happens, you don't want to box out people trying to get started, because the County Line barbecue problem is being exacerbated by a bunch of other restaurants that have problems finding people that don't want to take an hour and a half to get into work. So part of this is well, that Sarah will, we have a slight disagreement, okay, on some of these, but I'll push back that government needs to get their act together and stop having these falsely high percentage, square foot starting positions, because it just drives up cost.
Real quick, so you're saying that it's possible that the state comes in and starts,
Says,
getting
here's some
onto these
top-down
minimum
guidelines like we did in SB2 that say, sorry, you can't do this. Now look, because you look at Houston's success with it. Now, Houston doesn't have zoning. It has different land usages, but a 1,400 square foot place costs a lot less than a 5,500 square foot place, much less in Austin. And that's government needs to step back and get out of the way so people like Habitat for Humanities or everybody else can get the job done and start building some affordable housing.
I think Paul should run for local government. He's so interested in zoning cases that perhaps he should run for city government. But we're in state government. And I would suggest that, again, if the state were to pay its fair share, that would be the biggest property tax relief. If we waste our time and this historic moment with this large one-time surplus, bickering over zoning in the city of Austin, we will miss our moment. The remedy, if your local elected officials are not acting the way you want, is to go and vote. I voted. You have tomorrow. Tomorrow is your last day of early voting, and then next Tuesday is election day. That is a local election. State officials are not super constituents in any municipality anywhere in the state of Texas. We have state responsibilities, and we should live up to them. When we start meddling in local politics, it's because we are shirking our responsibilities and trying to divert your attention to something that is not ours to decide.
This would be the point of the committee hearing, I would say, may we move on? No, that's it. No, and look, the difference is, Sarah's expressed this in committee, we have a difference in philosophy. I think you have to have top-down guidelines, because quite frankly, local government just doesn't work as well as it should. Now, under her—
Neither does state government.
Well, okay, but listen, no offense, I mean, John Whitmire and I regularly barbecue bureaucrats on the finance committee. If you walk in, you don't have your act together, believe me, you may not like what happens to you when you come out. And Josh, the reason with all this is simple. Look, it's what gets measured gets fixed. If you got a huge backlog in permits in your municipality, you're not doing anybody any good. You're picking winners and losers, because what happens is everybody starts getting phone calls, city councils start getting calls, everybody gets friends, they get favors, whatever else. Just get the job done. That's it. See, if we get that mindset, that also gives me less cost, and therefore we have less property tax. But you can come to any of our meetings and we'll continue the discussion.
I feel like you just had one. So about now, I want to open it up to the floor for questions. Anybody who wants to ask, where are the mics at? Or we'll start over here then.
Sorry, did you point to me?
Oh, yes.
Okay, thank you. And thank you, senators, for being here. My name is Pat Valstreyes, and my question is whether you would consider supporting a bill that would create a mechanism to provide state matching funds to counties that have a county-funded spay-neuter program that assists low-income people who cannot afford to spay-neuter their dogs and cats. As a point of reference, I'll just let you know that a female dog costs about $600 to spay. There are spay-neuter clinics all over the state funded with donations that do provide a little bit of money to help that, but they tend to have a 6-month waiting period, by which time a dog may have already bred. So
By which time the problem is already resolved, right? So
by that time, there's already been one litter born, and that creates and contributes to a state problem, which is the pet overpopulation problem. And since we have a system of government that has, state taxes and also county taxes, I was wondering if you would consider a matching program that would incentivize counties to put in about half the money, the state could put in the other half, and we would fund spay-neuter for low-income people.
Josh, can I pass as a former tax assessor to a former county judge?
No, you're really interested in being a city council member, so you should answer this.
All I want is your great experience, because you actually had that department work for you in the county.
So it's true. Animal control is predominantly funded and controlled by city and county entities. The state puts no money, to my knowledge. Pat, you would know better.
I think zero.
State has an animal-friendly license plate fund where if someone goes and contributes a donation, but when they buy their license plate, that money funds a little bit of spay-neuter, but it's a minuscule amount.
So a dedicated fund like that is really important. I would suggest that we do take a look at public health contribution levels at the state compared to how much is being paid for by cities and counties. Cities and counties are filling the gap massively, and the state is not. So I am in favor of looking at ways that the state can come in and alleviate that burden some, and certainly animal control is part of that.
Over here.
Jim McDonald, Pflugerville City Council member. I remember the discussion we had back on the budget with the gun range. The gun range line item was $100,000. We also removed, and this was in discussion with whether we would go with an 8% increase versus a 3.5% increase. SB2 had just recently passed, and we claimed some emergency contingency. I can't remember what happened in March in 2020, but during those discussions, we decided to cut the gun range, which is $100,000. I think $150,000 came from a capital parks master plan, which delaying that unfortunately put us out of compliance, and so we're getting caught up with that this year. $200,000 of that came from a transfer from our emergency fund, and another $200,000 came from revising sales tax projections, which, as we all know, those numbers come in late in the year, and they were oddly up in Travis County during that time. Everyone stayed home and made purchases at home instead of traveling to wherever else they worked. So yes, that was a difficult year. But that said, in the greater Austin area, we have a lot of very fast growth cities, a lot of fast growth municipalities, and we face unique challenges. Is the League interested in looking at some sort of, I don't want to say relief, but assistance for fast growth cities like Pflugerville, Cedar Park, there's others, in terms of making sure that our infrastructure keeps caught up with the growing population that we have?
There's a couple things that are interesting about that, and I'm glad you brought that up, because he literally, they had to set priorities, and it was a difficult year for him. But I also love the get up, so ho ho ho, and Merry Christmas to you too. Okay, and so that's an important part of the decision making that you've got to go through. Now there's some federal money that's in there looking for any type of lead-lined issues that has come out of what happened in Flint, Michigan. There's money in for that infrastructure right now. There's also the speaker, you didn't mention it, Josh, but he's talked about the transportation, because what I love about these great interviews, okay, especially with Evan coaching or them doing it on their own, one of the two, is that you'll have a difference between the speaker will say, let's talk transportation, the lieutenant governor will say, let's talk property taxes, and then the question is, well, but the property tax language is not the same between the other two, so it's always a fascinating game of ping pong. But to answer your question, yes, I believe there's going to be more infrastructure investment, okay? That's clearly something that's on people's mind. We've got, very strong committee chairman in transportation, Robert Nichols, who believes in it strongly for once, and also a very strong water chairman, Charles Perry, that sits, closer. Or did you move, or are you just still on our side of the Capitol building, seating-wise? Sorry.
I'm still on, yes, I am the far left on the far right.
Right. Right, which is good, because I'm the middle right of the complete right on this, surrounded by right. Okay, that's right, where I sit. So it's a good question. Yes, I think the answer will be.
So, council member, you raised such a good point, and I also want to. This may be anticipating one of your questions about non-taxpayer approved debt. Didn't y'all recently decide on a CO for transportation infrastructure? And the reason why I raise it is because Paul and I, this is an area where Paul and I have a difference of opinion. He believes that all debt should be voter approved. In my experience, if we must wait for voter approval, our debt will be larger and more expensive, because we won't be able to take advantage of moments where we can get that project faster and cheaper for our taxpayers.
Thank you. Yes, our council recently approved a significant certificate obligation in conjunction with our downtown east development for our new municipal building. In the argument there is it's like costing us $1.2 million per month that we delay this project, and so putting it off to a voter issue, which.
Well, no offense. There was just an election in November. Why didn't you put it up for voter approval then?
I skipped a year in council, so I wasn't. I was from 20. I didn't sit there from 2020 to 2021. I'm recently returned, so I can't answer for council actions then.
Okay. Well, and Sarah, let me say this without knowing that answer. I will tell you that there is. We did have a bill that put part of the certificates of obligation under Senate Bill 2. Because people were using it for a whole variety of things.
And those people, if they misuse it, should be voted out.
Right.
Don't kill the tool because somebody misused it.
Well, no, but we didn't kill the tool because we only covered part of it. Now, I'll give you an example in Amarillo, because it was a stunning testimony.
It was.
Amarillo was presented, the voters of Amarillo presented a $250 million entertainment complex, which, by the way, you factor that up to Travis County or Harris County, you're looking at billions by comparison. Big project. Voters turned it down. Well, that city council decided they would do everything they could to go around the voters' turn down. So they ended up using COs with a combination through a TERS to be able to get a revenue bond to go build this $250 million entertainment venue. And a plucky taxpayer who came to testify in front of our committee laid it all out. He had gone to court, and a court not only sided with him, they voided all the contracts and looked at the new laws that we passed, because whatever you do, don't go around voter approval. Now, as much as I am an economic conservative, I wouldn't have voted for the big transportation property tax increase. I wouldn't have done it that you all did 2 years ago in this town. However, once you vote for it, I've got to support it by saying the obvious, which is the public voted for it, and if they want it, they get it. But the real problem, and what I look for, is stop the wire arounds, because we had COs being put out for $100 million that were just pure bond money because they had lost votes of the public, and I'll do everything I can to stop that.
So I'm going to chime in on this because It's true. There are some people out there who do dumb stuff, and as I recall, those people in Amarillo were voted out the next election cycle. And that's the remedy. But there is still, that the tool was misused in that circumstance, but the tool is still good, and I will give you a couple of different examples. Travis County was growing in leaps and bounds, and we were out of office space. We had people who were literally 3-person to a cubicle. We absolutely needed new office space. An office building did not go on the market, but we were made an offer for an office building that was 15 years old. We could not go to bond before buying that office building because it would not have been available. And so we issued COs and we bought it quick. It was like a used Lexus. That building will serve us for decades. If we had to wait for voter approval, we would have lost the opportunity to purchase a used Lexus for easily a third of what it would have cost for us to get that kind of office space. Second example, we needed to build a courthouse. Deeply, deeply needed new courts infrastructure. We went to bond and we lost that bond. It was in 2015. We had costed it out in 2015 as a roughly $330 million project. We turned around in 2016, negotiated a public-private partnership on a different piece of property, CO'd it to secure the different piece of property, and it is opening next month for $330 million guaranteed price because we CO'd it. If we had had to bond it, if we'd had to wait for voter approval for 3 more years, we would have been in the middle of the pandemic, and the cost of that project would have been at least 50% higher for the taxpayer.
Quick question before we go over here and wrap up. The Speaker of the House and Lieutenant Governor set aside $3 billion in federal stimulus for potential property tax relief. Is that still on the table?
I mean, it's still set aside. It hadn't been moved yet.
Okay. Over here.
Good afternoon. Thank you for making this last session entertaining, at least. I was a little worried about all the numbers as the end of the day. I'm down from Killeen, Texas, near Fort Hood, and I was just wondering if you could speak to how the various property tax options and the discussions that are going on may impact areas like Killeen that are already, where our tax base is already deeply impacted by the 65 plus and the disabled vet exemptions.
What she's talking about is that the disabled veterans get the same equivalent property tax exemption as over 65s. So when you have a high concentration, which you do in Killeen around Fort Hood, then you do have an impact to the tax base. I've had the senator from that area, Pete Flores, approach me so that he wants to come visit the committee. So we'll be looking at that issue too. And but I'm glad we've been entertaining.
I have a suggestion for you. And it's a little bit of a math problem, but here's the deal. I completely agree. When you increase your over 65 and disabled exemption for the county and the city, and you have a 3.5% revenue cap, that means a drastic reduction in your city and your county coffers. So what I would suggest that we talk with Senator Flores about, and also discuss at the local government committee, with this one-time money, what we could do for communities like Killeen is if they will do, if we're going to do a higher, let me back up for a moment. Right now, the only thing that's being discussed is a higher over 65 under school district taxes. But if we were to talk about—
It's actually all-age homestead increase, all-age homestead increase.
Yes.
Okay.
But if we were to talk about over 65 and disabled, an increase in the flat dollar figure for over 65 and disabled, we could use one-time state money to give a break to that taxing entity's effective tax rate for a year, use one-time money to buy the increment for that local community and reset to the higher over 65 and disabled exemption.
Well, and the only thing because that's her idea, the only thing I would change about what she said is that that's a 3.5% is not a revenue cap. That is a rollback rate reduction, which means you can increase last year's tax roll by 3.5%, but you get this year's new growth as well, all right? So it's not a 3.5% hard cap. So I didn't want to leave that with you.
And he's absolutely right about that. But you too are right that if you increase the over 65 and disabled tax exemption underneath this 3.5% mechanism, it does reduce your overall amount of revenues. So we could fix that if we're willing to use this one-time money to do a reset.
So what I'm hearing is, we got one last one.
Jim Brennan, I'm with the Texas Coalition of Veterans Organizations, excuse me, Legislative Director. To this last question, we've worked the last several sessions on addressing the disabled veteran exemption in areas of the state with high population. And we continue to work with Representative Buckley and with the Killeen delegation over the last 2 sessions to try to come up with some formulas and some ideas to make sure that the impact is not disproportionate. And we're hopeful to be able to do the same during a comprehensive look at property taxes this coming session. So I hope we have a chance to visit with you all.
Well, it sounds like Ross and David from the committee are going to expect to visit shortly. So thank you.
Good.
Okay.
No, so what I took from this is everybody's going to get what they want. Everybody's going to get property tax cuts. They're going to get increased spending, right?
Well, that's a fascinating thing about this, Josh. Let me try to just summarize it and let Sarah come back with it too. When you don't have any money, okay, then generally everybody gets nothing, okay? So, and when you have too much money, the hard spending caps cut in, okay, and everybody gets nothing. No, it's a joke, okay? So that's, but when you look at this, the pendulum, when it swings that wildly, there's always issues on both sides. Because part of what you don't want to do is, for example, I think we had a bill, Sarah, I can't remember which way you voted, but we were going to put $3 billion into a 1-year tax cut, which would have been about a 10-penny reduction on schools. It passed overwhelmingly in the Senate, but to keep it up, you'd have to do $3 billion, and then $3 billion, and then $3 billion, and then $3 billion. So after 4 years, that's almost the figure that the governor talked about. So you can have a variety of solutions, but you have to look at sustainability long term. And the fact of the matter is, those caps are there, I think, for a good reason, which is, you don't want to have I'm glad we're only here occasionally in session. I would not want to be in a place without a balanced budget amendment and be in session 24/7 for 700 plus days every 2 years. You would not like the outcome of that.
On the bill that Paul mentioned, I wasn't in favor of it initially because it was one time and not sustainable. Once it became sustainable, I voted for it. And that's where we are right now. Property taxes suck. I hate paying my property taxes too. Let's find a structural, long-term, sustainable solution. And that solution must include the state paying its fair share for statewide infrastructure and statewide concerns. I'm all for that. Let's do it.
I'm glad you changed your vote.
All right, well, that's all the time we got.
The House fixed it, and then I voted for it.
All right, well, we're at time. Thank you all so much for taking part in this. Thank you all for being here, and thanks for sticking with us all day. Appreciate it.
And thanks for the Tribune extending the gracious invitation and allowing us to have a repeat of our really well-known committee hearings between the two of us.
So Paul was invited to this thing because he's the dude on this issue. And then he asked that I be the other person, and I didn't know whether he was asking me because I was an easy foil or because he really likes me.
Well, if I'm the dude, that makes her an intelligent dudette, okay? I'm not sure. All right, but yes, we do enjoy the conversation. Thanks so much. Thank you for the Tribune for the invite.